Hi, Nicole. I found your presentation on music therapy interesting. I just had a lot of thoughts about your article as well. It makes complete sense that opioid use would increase the STD rate, but it wasn't something that I'd really considered before. And it just kind of shows that there will be an increased need for nursing and healthcare in those areas as well. Not only like nurses that are going to be helping treat people who have opioid addiction, but also nurses who are going to help treat like complications of opioid addiction, such as increased STD rates and the issues that can cause with pregnancy and pelvic inflammatory diseases and those kind of things. So I think public health nursing should grow theoretically as long as that there's a budget for that, and that's kind of always the problem in that area of nursing, it seems like. And I think that it's also important for us to create easy access to public health care for patients, because as you said, most of the opioid patients don't, or opioid addicted patients don't have access to insurance. I also found it interesting that Kentucky is one of the states that prohibit giving prescriptions to the partners of people with STDs. I definitely think that that's something that would be greatly beneficial all around. It would reduce our STD rates, I would think, by quite a bit. So it's definitely something that I hope to see change in the future. As far as music therapy, I totally agree. Music therapy is so important. It's something that we actually use pretty frequently in pediatrics. We actually have a music therapist who comes around certain days of the week. I work nights, so I'm not actually sure what days those are, but they come around certain days of the week and play music with our patients. They'll play the guitar, they'll sing songs with them. It's really great. We probably use that a little bit less in the PICU just because a lot of our patients aren't capable of participating in that due to their critical illness. But we do, I would say in the PICU, use every day almost music therapy. We'll pull up lullabies on YouTube for our babies while they're trying to sleep. Or when they're just teetering on the edge of not being well sedated. Sometimes just those lullabies in the dark room make all the difference. And I think that music therapy is something that you can use every day, whether you're in the hospital or whether you're not. And it really does have the ability to change kind of your mindset. And it's so important. And I think it's something that I'm not sure, but having been a patient in an adult unit, it seems like that's not something that's as used there. So I think it's something that we tend to forget about when taking care of some of our adult patients. And I think it is something that we should always think about. It's great. It's a great adjunct to other things that you're doing. So great job. Thank you.